Okay, so we're going to do histology of periodontium today. Again. So what comprises the periodontium? That is the PDL, cementum, and alveolar bone. The periodontium includes cementum, alveolar, PDL. I hope you guys remember this from the last exam. So first we're going to go over the PDL, or periodontal ligament. So this is a specialized form of connective tissue. Do you guys remember where it's derived from? Which structure? It's derived from the dental sac. So this surrounds the roots and it contributes to the attachment. See, here's the PDL, how it surrounds the root. And later we're going to learn about these lines. I just want you guys to pay attention real quick. You see how this one is straight across and how everything else is very slanted? Just notice that. We're going to go over what that means later, but it's very important that you guys notice these qualities on these, or characteristics on these pictures, because you're later going to be learning this in the video. So PDL attaches the tooth to the bone. It's composed of mainly fiber bundles. So here's the PDL right here. See how it attaches the cementum to the bone, and it's mainly, it looks like little bundles and fibers right here. So, and then this is a histological picture, cementum to bone. Here's the PDL. Components of the PDL: mainly collagen fibers. They have sensory nerves and blood vessels. The primary cell in the PDL is the fibroblast. The ground substance is proteoglycan. You're going to see this word a lot of times, proteoglycan. So make sure you guys know that is a ground substance for most of the things. So the components of PDL: the osteoblasts are on the alveolar side. The cementoblasts are on the cementum side. There are osteoclasts and odontoclasts for resorption. And there's undifferentiated mesenchymal cells. What this means is these mesenchymal cells don't have identities. And this is important because let's say you run out of cementoblasts, but you have too much osteoblasts, not enough cementoblasts. Those undifferentiated mesenchymal cells don't have an identity, so they can easily become cementoblasts. They can easily become an osteoblast. Whatever is needed, these cells can create whatever is needed, basically, because they don't have an identity yet. PDL is primarily collagen fibers, like we said. It has few elastic fibers, but they do have blood vessels, arranged in dense bundles, like it showed in the pictures. They insert into the alveolar bone and the cementum. There's two groups of fibers for the PDL: gingival and principal. Now, I want you guys, there are 10 fibers that we're going to go over. Make sure you guys have this memorized. According to Zenosa, all 10 of these are going to be on her exam, and I'm pretty sure it's going to be matching. But they are common sense, so it's not super hard to study. But the gingival fibers, also known as supragingival fibers or supracrestal fibers, where do you think it's located? Above the gingiva, above the crest. So they brace the marginal gingiva against the tooth. They reinforce attachment of the junctional epithelium. They provide rigidity for mastication, and they unite the free gingiva with the cementum and alveolar bone. So gingival fibers also connect adjacent teeth. They control tooth positioning, and they're organized according to the origin and the insertion, just like muscles. So there are first we're going to go over gingival fibers. There are 5 gingival fiber groups. You have circumferential or circular. I wonder what that does. Dentogingival, dental periosteal, alveologingival, interdental ligament, or transseptal ligament. So circumferential or circular, this is located in the lamina propria. It encircles each tooth separately within the free gingiva, and it provides support and comfort to the free gingiva. Dentogingival fibers, this is embedded in the cementum. So here's your circumferential fibers right here. Dentogingival fibers are a little bit higher up. It's between the CEJ and crest of the alveolar bone. It extends to the lamina propria of the free gingiva and attached gingiva. So the circumferential was free gingiva only. Dentogingival does free and attached gingiva. And this attaches the gingiva to the tooth, apical to the epithelial attachment. So dental means tooth, gingival means gingiva, attaches the tooth to the gingiva. Dental periosteal, this is embedded in the same portion of cementum as dentogingival. It extends apically. It terminates in alveolar crest after passing through lamina propria, and it anchors the tooth to the bone. So I want you guys to look at the shape of the dental periosteal fibers. Notice how it literally looks like an anchor. It looks like it's anchoring this tooth so that it doesn't move, versus everything else is kind of just straight up and down. This one curves. So this literally looks like an anchor right here. Okay, Alveologingiva. So this extends from the periosteum of the alveolar crest coronally into the connective tissue. Again, lamina propria of the marginal gingiva, and attaches the gingiva to the alveolar bone. So alveolar bone, gingival, gingiva. Attaches gingiva to the alveolar bone. Interdental ligament or transseptal ligament. This is the cementum of one tooth interproximally to the cementum of the adjacent tooth. It goes over the alveolar crest, it secures the alignment of the teeth, and it protects interproximal bone from inflammatory infiltrate. So here's that interdental ligament right here. And look, this is a better picture. I like this picture a lot more. It's embedded in the same portion of cementum as dentogingiva and dentoperiosteal fibers. So here's the interdental ligament. Inter means between, dental teeth, so in between teeth. Here's the ligament, and it protects that interproximal space, like it says here, from inflammatory things. So it's right in between the teeth, interdental. There's right here, interdental ligament. And you go straight across. So now we're done with the gingival fibers. Now we're going to go over the principal fibers of the alveolodental ligament. This is also 5 fiber groups, and it distributes forces exerted on the teeth. So you have rotational, tilting, extrusive, and intrusive. And then we have and it's anchored in cementum and bone. So the continuation of gingival fibers, this is named according to the direction and insertion of location, just like the other one. There's alveolar crest, horizontal, oblique, apical, and interradicular. So here's the alveolar crest. This should be a little bit more down, but it's fine. So you guys know what alveolar crest is. Remember, that's a little thing on anterior teeth it's sharp and pointy, on posterior teeth it's flat. That's your alveolar crest. Horizontal goes straight across. Oblique is slanted. Remember I told you guys at the beginning of the video, notice those lines on the PDL. Apical is towards the apices, and interradicular is in between that crotch area, in between like where the furcation area is. So alveolar crest fibers, which are located right here, these originate in the alveolar crest. They insert into cervical cementum and they keep the tooth in the socket. They resist tilting, intrusive, extrusive, and rotational forces. These are the first fibers formed before eruption, but they are also the first involved in changes caused by periodontal disease because they're right there. And this is the alveolar crest. Horizontal fibers, these are the ones that go straight across. Notice how these are the only ones that aren't slanted. These originate in the alveolar bone apical to the alveolar crest. They insert into the cementum at right angles to the long axis of the tooth, and it resists tilting and rotational forces, and it's the second fibers to form, which makes sense. Right under alveolar crest, we have your horizontal fibers. It's next. Oblique fibers, these are the slanted lines. These also originate in alveolar bone. They insert apically and obliquely into the cementum. These resist intrusive and rotational forces. They are the principal attachment of the tooth and it's the most numerous, covering about 2/3 of the root. So look, this part right here is horizontal because it goes straight across. From here all the way down to here, which is about 2/3 of the tooth, you have oblique fibers. So it's the principal attachment of the tooth because there's so many of them. Apical fibers, these are the last fibers to form, obviously, because they're down at the apices. They radiate from the apical region of the cementum. They insert into surrounding bone, and they resist extrusive and rotational forces. Interradicular fibers, remember this is in that crotch area, so it's only seen on multi-rooted teeth. So it's not seen in your incisors, it's not seen in your canines, it's only seen on like your molars, some of your premolars. That's where you see interradicular fibers, where the crotch area is. It inserts on the cementum of one root to the cementum of another root. It's superficial to the septum. There is no bony attachment. It resists tilting, intrusive, extrusive, and rotational forces, and it's lost when the bone is destroyed. So this is a better picture. So here's your interradicular group right here. Notice how it's not touching the actual bone, and it's right above this septum. Here's the interradicular septum. Here is the interradicular group. It is touching this purple part, not the actual bone. That's very important to notice. It's not touching the cementum. It's just touching. It's not touching any bone. And then if you want to go over it again, here's the crest. Next, you have the horizontal group, which goes straight across. It's straight. Then you have your oblique group, which is the principal fibers. It's the most numerous. It covers about 2/3 of the teeth. Lastly, you have your apical group. If it's not multi-rooted, apical group is where you stop. That's by the apices. If the tooth is multi-rooted, has a crotch area, has furcation, that's the interradicular group, which is right above that interradicular septum, and it doesn't attach to bone. Okay. Sharpie's fibers, these are at the ends of the principal fibers. They're embedded in cementum and alveolar bone, and they go in at 90 degrees. Here are your Sharpie's fibers. Now we're going to go over the cementum. These are calcified connective tissue. They're derived from the dental sac. The dental sac has cementum, alveolar bone, and PDO. It covers the root surface. It's part of the attachment apparatus and attaches the tooth by anchoring the PDO. The chemical composition, it resembles bone in structure. The crystalline portion is calcium hydroxyapatite. Remember, that is a very important name because we see it all the time. It's the least mineralized of the calcified tissues. Cementum is 65% mineralized, 23% organic, and 12% water. And this chart shows right here. So enamel is the most, has the most. Dentin has the second most. Cementum has the least. Cementum is avascular, which means it doesn't have any blood supply, it doesn't have any nerves, it gets its nutrition from the PDO, and it forms throughout life. Imagine you know how we just learned these instruments? Imagine if cementum had nerves or innervation, how much pain we would all be in, because we didn't know what we were doing. So the cementum is thickest at the apex in the interradicular areas. It's 50 to 200 micrometers, and it's thinnest at the CEJ, which is 10 to 50 micrometers. And our goal, whenever we use those instruments, we don't want to scrape off the cementum. That's not what we want to do. And it's thinnest at the CEJ, so hopefully you're not getting a lot of cementum, and you wouldn't have to go down to the interradicular areas. If you do, that patient has an issue. So we don't have to worry about removing cementum from there because we don't even scale down there. So tissue composition, you have cementoblasts and cementocytes. It has the word cementum in it, obviously. So fibrous matrix collagen fibers, just like the other one. It's a very dominant component. It's mainly made up of collagen fibers, about 90%. And like I said, ground substance, proteoglycans for most of it. Development of cementum, cementogenesis, that's development of cementum. That occurs with the laying down of cementoid, and cementoblast is what lays it down. The cementoblasts then become entrapped in the cementum, and then they become cementocytes, they mature. The cementoid calcifies, and once it reaches full thickness, then it becomes cementum. The ones that aren't trapped in this, the cementoblasts that aren't trapped, they lay down more layers of cementum. And remember, there's this a lacunae, a caniculi. Those two things lack nerves, and it's oriented towards the PDO because remember, the PDO is what gives the cementum nutrition. So the developing root has little cementum until the tooth reaches functional occlusion. It's approximately 2/3 of the root formed when a tooth erupts. Now we're going to go over the two cementum fiber groups. You have the intrinsic fibers and the Sharpie's fibers. So the first group of fibers, the internal or the intrinsic fibers, these are non-periodontal fibers. They're composed of collagen fibers. They're formed by the cementoblast, and they run parallel to the long axis of the tooth. Group 2, or Sharpie's fiber, these are part of the PDO fibers. They're produced by the cells from the dental sac. They insert into the cementum at right angles to the internal fibers, and they insert into the alveolar bone. Cemento-Enamel Junction. So you have three relationships with cementum and enamel. Just remember, enamel can never overlap cementum. Cementum has to overlap enamel at all times. So you have overlap, meet, and ditch. So when it overlaps, the cementum overlaps the enamel a short distance. It's only about 14% of the cases. It's not as common. Meet is the most common. It's when it meets the enamel right here, and that's 52%. And then gap, is 33%, where there's a small gap between the cementum and the cementum and the enamel. That small gap right there. So cementum repair, this